Hi, I'm Lucy from Pinkham Equine. Carrying on in our series of webinars on our website, I'm going to talk a bit about examination of the newborn foal. Nice and topical at the moment. We're starting to get foals on the ground. Some of you might be expecting your first ever foal, or you might have experience of foaling, but it's a good idea just to run through what we're looking for and what to expect, just to remind yourselves. So immediately post-foaling, I won't talk about the actual foaling, but provided all's gone to plan, your foal comes out, and the first thing is not to panic. You don't need to jump on this foal. The mare, the foal, they know what they're doing. Just make sure there are no membranes over the muzzle, and you're looking for signs of life. Being born is quite hard work, and when they come out, they're really puffing, the chest is going up and down. You can often see the heartbeat from a distance, and the main thing is their movement. These foals move quite a lot. They have a little thrash, they try and sit themselves up. And that's what we're looking for. You can see all of that from a distance. When is intervention needed? If a foal is born unresponsive and you haven't got a vet, most foals will respond well to just being vigorously towel dried. Give them a good rub all over, and that will stimulate them to get going, to sit up, to start breathing really well. Sit them up in sternal, so on their breastbone. It just allows both lungs to inflate as opposed to one being squashed underneath them. Gives them the best chance of getting lots of oxygen in. Poke up the nostril with a bit of straw. That gets them to shake their head, take a bit of a gasp, just to stimulate them a bit more. If you've got oxygen, brilliant. You can poke the tube up one nostril and it just oxygenates the air they're breathing in. It's not essential. In the worst case scenario, you might need a ventilator. If you're getting that far, you do need someone to have called your vet. You can get these resuscitators that just push air into the airways via a mask, or you can give them mouth to nostril resuscitation. So horses breathe through their noses, so you need to pinch off the other nostril, put your mouth over the open nostril and just pinch the throat halfway down, and that just occludes their esophagus, so you're not blowing air down into their stomach, and tries to redirect it into their airway. But hopefully you won't need to be doing any of that, and if you are having to do any of that, then call a vet ASAP. The next job is umbilicus, so always wear gloves. This is the main point of entry of bugs into foals. Their immune system isn't up and running as yet. They're born with very little immunity to environmental pathogens, so that's the main point at which bugs can get in. You need to be nice and clean with that and get it dipped as quickly as you can. Nice clean pair of gloves. Check it's not bleeding. It will bleed a bit. You don't need to be pinching it off unless it's really gushing out, and it carries on gushing out for some time. There will be a whoosh of blood when it first separates, but that's normal. Do leave it to tear naturally. That's important. You don't need to whisk this foal up to the mother's head. Naturally in the wild, these mares will take a few minutes to recover, then they'll stand up and the cord will break and they'll turn around and look at their foal. It's been shown that up to 1 litre of blood can be transferred in that time, which is really important for these foals. Perfusion and getting all their organs, their brain up and running. So just leave them attached if that's what's happening, and the mare will sort the problem out herself. You don't need to be snapping these cords prematurely. Make sure there's nothing poking out of the navel. Guts can make their way out. Anything poking out we need to know. And then as far as dipping, this lady is spraying. I would advise dipping more than spraying. She's spraying. I think the dip just gets right up the tube and kills off bugs a little way in that might have already got in. So we would advise the best known thing, there are lots of studies been performed, 0.5% chlorhexidine solution with a little bit of surgical spirit just to help with drying is the best. Has been shown to be the best naval dip. 2% iodine is okay. What you want to avoid is the 10% iodine, because it's really astringent and it sloughs off the tissues and makes the problem worse. That's the stuff you get from the farmer's market for dipping calves' navels. It's probably not good for them either, but it's what historically has been used. If you haven't got anything or you can't find anything, give us a shout. We can make you some dip. That's easy. So what are we looking for in these guys? They're umbilicus, we've been through. An enema, I would give all foals a fleet enema, so a phosphate enema, so that's what this guy here is doing. I would wear gloves to do it. Just quickly run your eye over the foal. Eyelids, are they turned in like this? So that's an entropion. Some foals are born like that, and that needs correcting ASAP. Their ribs, you will only really be able to see broken ribs or no broken ribs are there if there's a lot of them and you can see the difference in the chest wall, but it's one of the things we will check for. Broken ribs quite common in big foals, difficult foalings, and especially if they came backwards, which is quite rare. And can cause real problems later on if that rib that's broken suddenly moves, can puncture lungs and things. So we don't necessarily do anything about them, but we need to know they're there because we'll manage the foal differently. The main thing you're looking for now is legs. Are they bent too much? Is this foal a viable foal? Is it going to stand? These legs here in this bottom picture, that's as straight as these legs could go. Now that foal is not going to be able to stand to nurse. We've got a long way to go to get those legs straight, and in that case that foal wasn't deemed to be viable because it just had too much of a mountain to climb to get those legs straight. Any other congenital abnormalities like this guy with the wry nose, is it fair to keep him going? Is he going to be able to suckle properly? Is he going to be able to feed properly? And then the other thing is, with a clean gloved hand, just poke your fingers in the mouth and make sure they've got a suckle reflex, and that they lock onto your finger and that they are looking for milk. But you do all that really quickly. You don't need to do any of that in depth. You're just roughly casting your eye over the foal and trying to predict any problems you might have. Do I need someone else to come and look at this foal? And then retreat to a distance and just observe these mares and foals. It just gives them time to bond. Especially nervous maiden mares can be really put off by you faffing about with the foal and interrupting them, and maidens as well will sort of let you take over and not get on with it themselves. So do just retreat and watch them from a distance, and you're looking for normal progressions, and these are fairly well dictated. We know what time scales we're looking for, so they should be in sternal recumbency, so sitting up on their chest, by 5 minutes. Most of them will do that a lot quicker. Breathing comfortably. As I say, it's hard work being born, but their breath rate should come down over time as they recover from that. They should be bright and alert. Ears pricked or ears starting to prick and looking about them and starting to think about trying to get up and find food. Then mucous membranes, so if you curl their lip back, should be nice and pink and moist. Shouldn't be blue or sort of going blue or bright red, anything that suggests they're compromised in any way. They should attempt to stand within about 30 minutes of birth. A lot of these guys will do that quicker, but they should be trying by half an hour, and if they're not, then that's a concern. And they should be standing and sucking within 2 to 3 hours of birth. So it's not an instant thing, it can take a little while, and we've got a little window to get them up and about. Obviously, if they're just lying there in a heap and they're not trying to do anything, then we probably need to know sooner. But if they're giving it a good go and it's just taking them that bit longer, then 2 to 3 hours is fine. But if it's getting sort of over the 2 hours, you probably need to start thinking about giving us a call to come and help these guys out. The mare, just briefly, just check whether she's torn underneath her tail. Some tearing can be really severe. This is fairly mild up here. We're not going to do anything about this for a day or two. We're going to let that swelling come out, and then we're going to stitch that back together, and that'll do fine. But some tears we might want to see sooner. We're unlikely to repair them we tend to let them granulate, but it's good to know they're there. The mare will show some mild discomfort passing her placenta, and post-foaling she might look a little bit colicky as she passes the placenta. That is normal, but anything sort of extreme or untoward or doesn't go away once she's passed the placenta, we would like to know about that. 3 hours is the sort of give us a call if she hasn't passed her placenta in 3 hours. It gives us time to get it out. If she retains past 6 hours, particularly in thoroughbred mares, it is an emergency. These mares can get sick and go downhill very quickly. They get a metritis, so an infection in their uterus, and that can lead to all sorts of obscure problems, most notably laminitis, which is a real problem. So the quicker we get that placenta out, the better, and we might need to flush it, or if we do leave it in there because it doesn't want to come, we want to get that mare on antibiotics and some treatment. So give us a shout if it's 3 hours and she hasn't got rid of it, because it gives us a bit of time to get to you and help sort the problem out. Examine the placenta yourself, or put it to one side and we'll have a look at it. You should weigh it, really. It should be 10% of the foal's weight, so if it's extra heavy, there's probably some placentitis there, some edema in the placenta. There's loads to be learnt from the placenta, and if you're not sure what you're looking for, so you're looking for these two blunt ends. Some people lay it out like an F, like this, some people lay it out in more of a Y shape, but you're looking for the two horns with nice rounded complete ends and no holes, and this is the star where the foal came out. And if you're not certain what you're looking at, not certain that it's all there, then put it in a bucket and we'll have a look at it. That's no problem at all. As I say, it can cause such problems, it's important to make sure it's all out. So the next job is getting the foal on suck, which is one of the most frustrating jobs there is, and watching these foals, I find it really difficult. I just want to tube them and go back to bed, which is why I do what I do and not the sitting up bit. So you need to allow the foal to try unaided. You've got 2 or 3 hours. It's frustrating to watch. Just observe it from a distance, see how it's getting on. Some foals do need assistance, but by assistance, just gently stand them in the right place. Maybe move the mare so she's in an easier position for the foal to get to. Give the foal a little scratch just above the tail, like mum would do. Try and stimulate that suck reflex. And just be really patient and gentle. There's no point forcing a foal's head under the mare because it just doesn't get you anywhere. The foal gets tired, you get frustrated, mare gets annoyed, it just doesn't work. So gentle and patient, and if nothing's working by sort of 3 or 4 hours, then maybe think about giving us a shout. Colostrum is what we're aiming for. So these foals need to get colostrum. That's the first milk the mother produces. Foals are born with a very immature and weak immune system. Colostrum contains all the antibodies that the mother's got copied into this milk from her blood, and will protect the foal from any diseases that she's got immunity to. So all the environmental pathogens. They're absorbed across the foal's gut into the bloodstream. That's called passive transfer, and that opportunity for the gut to absorb those big antibodies across the gut only lasts for sort of 6 to 12 hours maximum, really. So we've got that 6-hour window where we need to be getting colostrum into them, otherwise it's not going to do us any good. So if your foal has got to 3 or 4 hours and it's not sucked, or it's not had enough colostrum, then give us a shout. Interestingly, colostrum can be frozen and stored. So other mares, if you've got a mare that's got lots when she foals, probably not a maiden, but an older mare, then you can certainly freeze it to have in reserve for other foals. And it's important to remember they need it for nutrition as well, so they need an ongoing supply of colostrum or milk for nutrition. It's all very well getting a good bit of colostrum into them, but they are going to need more down the line. So testing the quality of your colostrum is really important. There's a thing called a refractometer, which has a scale, the BRIC scale, which some clever person has worked out how that correlates to the quality of colostrum. I think 22% is 50 mg per mil of antibody, so that's sort of where we're aiming. So on your refractometer, you just put a drop of milk on it, look through the hole at one end, hold it up to the light, and it will read off on a blue line the level. Over 30% is excellent, provided the foal gets plenty of that, is going to be fine. Over 20 is good, under 20 is poor, and we probably need to substitute some of that colostrum with some better quality stuff, either frozen or from a donor mare. An adequate volume, so 400 mils, so not very much. One good feed of good quality colostrum is enough. If they've not had enough by 4 hours, then give us a shout, because it gives us a bit of time to sort out coming to you and getting some good colostrum into this foal. It's no good leaving it to 6 hours, because then we've missed the window, so do give us a bit of warning. Do avoid bottle feeding, not in all cases, but if you're experienced with bottle feeding, great. But unless you're really sure what you're doing and you've done it before and you're confident that the foal is really sucking well and swallowing well, then it's a better idea, especially for the first feed, to get us to tube them. We just know where we're putting that colostrum, and when they suck, if they don't suck very well, the colostrum can run into their lungs, and I've seen horrible pneumonias following that. So, and sometimes we tube them the once, and then they get stronger from that, and then the suck reflex gets better and the bottle feeding goes better. So unless you're sure, do give us a shout. And then the sort of take-home message, that if nothing else persuades you to really get on top of colostrum, then over 6 hours you have missed an opportunity, and the cost goes up exponentially, because if the gut is closed and we can't get antibodies across it, then our only real next option is plasma, which is an expensive option. So colostrum, cheap and easy to do. Yes, you might have to get us out to tube it, but it's nothing compared to the cost later on. So just bear that in mind if you can't decide whether to call us or not. Immunity is, so passive transfer, so taking on colostrum is, or not having enough colostrum is the biggest cause of disease in the first week of life, and it's annoying because it is avoidable. You can certainly reduce the chances of disease by making sure that colostrum intake is adequate. It's not the whole story. We have to remember that it's sort of half the battle. The other half is the environment and the size of the challenge that they come up against. So if they're born into this top stable, brilliant, they're going to have a better chance than if they're born into this stable here. They probably have all the colostrum they like, but E. coli will have got in through their navel if they've landed in that. So foot dip, and I keep saying it, but wear gloves to do everything. These foals don't have much immunity, and we don't need to be spreading bugs to them or challenging them with any bugs they don't need. So the next hurdles for them to cross are they've got to pass their meconium, so their first poo. We would administer 1 enema per foal straight after birth. Some people only do colts because they're more likely to retain their meconium than fillies. They've got a narrower pelvis, so a point at which it gets stuck. I would recommend carefully administering a fleet enema to all foals. It just sort of helps the balance of probability, and you see them pass a nice heap like this one has. You can relax a bit about this one. So signs that a foal has not passed meconium, they'll go off suck, they'll appear sort of distracted, often they'll go to suck, but they'll be sort of weight shifting and lifting their tail. They'll often be straining, tail flagging, so holding their tail straight up in the air, and they may or may not start to colic. It's often more severe when they start to colic. They sometimes pass diarrhea, watery stuff, and people think, oh, that's fine, they're pooing, but actually they're only managing to pass the sort of liquid content around the solid bits that are stuck in the way. So any of these signs, give us a shout. There's things we can do, varying from another fleet enema, but they do have phosphate in them, and you can see on a blood sample when they've had more than one. So if you're thinking you're going to give them a second one, then just give us a shout first and see what we think, because they might need something more than that, or we might just decide that we'll give another one a go and see how it goes. But yeah, give us a shout. We're always happy to give advice over the phone as well. Urination. So the first urination, fillies up to 12 hours, so it can be a long time before they do a wee. Colts are normally about 6 hours. The first wee, don't be alarmed if it's really thick and dark, that is normal. It's just getting rid of all that stuff that's sat there for a while. Are they voiding normally? Are they straining? Is there any urine coming from their umbilicus? So this is its umbilicus, and you can see there's urine coming out of here. We need to know about that. It just means that the tube to their bladder is still patent, so still open, and we need to probably get that one on some antibiotics to stop it getting an infection, and then get you dipping that with something a little bit more drying, just to try and dry the stump out. Are they voiding normally? It's if they're straining unsuccessfully. Now this guy here, you see these a lot, and people say, oh, he's trying to wee, or someone else tells you he's trying to poo, and sometimes it's difficult to know what he's trying to do. I think more often than not it's actually trying to poo than try to wee, but either way we need to know about it. He's uncomfortable, and he's getting fed up with straining like that, so we need to know. Foals can rupture their bladders, and particularly colt foals, so any straining unsuccessfully we need to know about. So then monitoring, you need to monitor them continuously for the first couple of hours, make sure they hit all those goals that they should have done, and then if you're happy that they've done everything that they should in that couple of hours, you can go back to bed for a few hours and just monitor them every 2 hours or so for the first day. They're very cyclical in their behaviour. They stand up, they drink, they urinate, they lie down, and they do that 4 to 7 times. So every 10-20 minutes they're up, they have a drink, they wee, they lie down, and then within the first 24 hours you'll start to see them having a bit of a play and a buck and a kick around the stable, and that's really nice to see because they're doing well. They should avoid human contact. That's their instinct, is to avoid you. So if they're mopey and dopey and they're sort of happy for you just to do anything to them, then just keep an eye on those ones, because they're often maybe mild dummy foals, which is a syndrome that maybe I'll do a talk about another day. Take the temperature twice daily. This is really useful for monitoring the health of your foal. It doesn't really, normal temperature should be under 38.5, but you get used to what your foal's temperature is, and then if one day it's higher, you'll notice the spike. So if you get into the habit of taking temperatures twice a day, it really helps with picking up things early if there's a change. And then you want to continue monitoring them frequently for the first week. Things can change really quickly in these neonates. They're very susceptible to problems and changes. And the quicker we do something about it, the less of a problem it is. So give us a shout if you're worried at all, if anything changes from the norm. And then a vet check at sort of 12 to 24 hours, we check these guys over from head to tail. So we're looking for entropion, so rolled in eyelids, parrot mouths, broken ribs, heart abnormalities. We listen to them breathing, make sure they've got good gut sounds, check their navel out, take the temperature, watch them walk, assess their legs, make sure there's nothing we need to be doing straight away. And the main thing we'll do is pull a blood on them to test their IgG, to make sure that they've absorbed enough colostrum and that we don't need to be supplementing them with anything else. We may also do a haematology, so look at their white cells, or biochemistry. So the most common bit of that we do would be looking at their kidney function, if we've got any concerns about their health or the quality of the placenta or the mare when the foal was born. But largely we'll do an IgG on these foals. We may give them tetanus if the mare's not vaccinated or her status is unknown, or the foal was supplemented with colostrum from a mare that we don't know about the tetanus status of. Most mares are tetanus vaccinated, so as long as they get adequate colostrum it should be fine, but belt and braces will cover them with a tetanus antitoxin. Antibiotics, we really try not to use antibiotics nowadays. Historically it used to be normal to give them 3 days of antibiotics. We're trying to reduce resistance in antibiotics, reduce the overuse of antibiotics. Most of these foals, provided they're happy and healthy and their IgG is satisfactory, don't need a course of antibiotics, and then we've got those in the arsenal if we need them later on, if the foal does get any illness. If we keep giving well animals antibiotics, we're going to make ourselves a real problem in the future. And we may or may not, well, we'll check the mare over and check the placenta for you if you want us to as well while we're there. Testing of the IgG, as I've said, we really recommend it. It lets us know how successful we've been with our colostrum and therefore what that foal's immunity is going to be like. We'd normally take a blood sample between 12 and 24 hours. Over 8 grams per litre is excellent, and actually if you're insuring an animal they will require it to be over 8 grams per litre. 4 to 8 is satisfactory, that foal has got enough IgG, but you know we need to monitor that foal. Under 4 is really poor, and we would recommend a plasma transfusion to get antibodies straight into the bloodstream. That's what's happening with this guy here. Normally 1 litre is enough to get them up, sometimes they need 2, and that's plasma from mares that have been vaccinated, and it's called hyperimmune plasma, and it's putting the antibodies direct into the bloodstream to protect that foal from diseases. So what's abnormal? What have we learned is abnormal? So unresponsive within 2 minutes of birth, we need to know about that. Any laboured breathing, like I say, if the breathing doesn't settle, if they look like they're puffing and finding life difficult, then that's not normal. If they don't attempt to stand in the 30 minutes and they don't make it up by 2 hours, maybe 3 hours, but it's sort of how hard are they trying? Have they got energy? Are they with it and trying, or are they just flopping in a heap? If they fail to nurse within 6 hours, or if milk runs down their nose, if they're urinating from their umbilical cord, it's not a massive emergency, but we need to know about it. If they fail to pass meconium within 6 hours, again, not huge emergency. Keep an eye on them. If they're bright and happy and not straining at all, then it might be that you missed it, but certainly have in the back of your mind that you need to monitor that foal and make sure it does start to pass some soon and that it's not looking uncomfortable. Is their behaviour depressed or stupid? We get this dummy foal syndrome where they've not had enough oxygen to their brain, and those guys can go downhill really quickly. So if they're sucking everything in sight, they're sucking the mare's stifles and under her belly and licking the walls and wandering around with their tongue stuck out, they really do look stupid, and dummy foal sounds like a silly name for them, but it's the name of the syndrome, and those ones can go downhill quickly, so give us a shout if they're showing any of those signs. And then the other thing is excessively bent legs or face. We might need to make some decisions about those ones. So thank you for listening. Hopefully, as I say, I have to flag up all the things that might go wrong, but 9 times out of 10 these things go swimmingly, and you've got a nice, happy, healthy foal at the end of it. give us a shout if you've got any questions. We're always happy to answer questions over the phone, or come and look at things. We'd rather come and look at something and say, oh no, actually that's normal, than not come and look at things that we should be sorting out quickly. So good luck with all your FOALs, and hope to see you all soon.